in this section, we talk about our intervention plan, what it is, why we feel that it would be useful, and also how we would like to see this plan implemented. Our intervention plan includes building the base knowledge of professionals like preschool teachers and doctors to increase their ability to recognize and respond to children who may be exhibiting signs or symptoms of mental health and behavior problems. We feel like the school setting is where kids spend a large portion of their day. There's lots of different people in the school who can have eyes and ears on kids. And also in the healthcare setting, we see that doctors are typically focused on patients' physical needs, and to be able to have them also direct their focus on both the physical and the mental health needs, we felt like would be very useful for kids who are struggling with mental health or behavior problems. The reason why we feel like this plan would be effective is because when you are engaging in training professionals who are working with young children, it'll increase early identification and intervention of these young children, and it'll help reduce the negative effects that these kids might be experiencing due to their mental illness or behavioral health problems. Another reason why we felt like this was educating professionals would be a good idea is because then we're getting a wide variety of people who are going to be able to spot these needs in young children. Then we will have, whenever your kid's at school, multiple people who are educated in mental and behavioral health problems, and also when your kid's at the doctor. So really just a big group of people who are going to ensure that things that like mental health and behavioral health problems aren't getting missed in our children. We all liked this idea of this intervention plan because it seemed very realistic. We thought it would be really impactful because it reaches across such a large group of professionals, and it can touch the lives of children every single day just because of the people that they're encountering. We also felt that, as social workers, we know that it's not really possible. I mean, we see the shortages in mental health providers in all of our areas, and we felt that it would be really beneficial for us to take our expertise and, mental health professionals' expertise, and we're, lending our knowledge or giving that knowledge to the other people who these kids are interacting with on a daily basis. In our research for this project, we kind of looked at a couple other different projects in Iowa that were looking to help work towards meeting the needs in children's mental health. One of those was Iowa's Project Launch. That whole program, it's actually no longer in existence, but it provided evidence that collaborative care among community providers produced a better outcome for clients. In this intervention plan, we felt that involving various community providers and professionals would allow us to cover a wide range of topics and really have a widespread opinions, and also be able to provide us with a variety of referral resources in the area as well. Along with getting various community providers and professionals involved in the training and education, we also felt like it would be really important in order for this to be successful to really make the training easily accessible to all the people that were interested. We felt like the easier accessible it was, then the more people would be interested in it. So we thought that offering an online webinar on a monthly basis, covering a different topic every single month, just covering different topics, you know, how to spot problematic or abusive situations, giving them detailed information on the impact of adverse childhood experiences, information on the types of behaviors associated with different mental illnesses and developmental issues, so that they could, you know, look out for those in their classrooms or in the healthcare setting. And then also having resources available to these providers. A lot of times, especially in small communities, so many people aren't aware of what resources are actually out there. So making sure that we educate the community about, you know, what's all in our area, how these people can connect with these people. We felt like these training webinars would be really impactful for people in early childhood and education settings, preschool teachers, elementary ed teachers, para-educators, classroom aides, daycare providers, both in-home and in licensed centers, and then also doctors, nurses, dentists, just all professionals who are spending time with children in the community. And then moving on to how we plan to collect data. With this intervention plan, we came up with the idea of a survey, and they will talk about that in the next section.